And I'd like to hand it off to Dr. Jim Karinji for introductions. Take it away, Jim.
Thank you, Patrick. It's good to see everyone and so many people jumping on the call for this important topic. So I'm Jim Karinji, professor in public health. I have the privilege of introducing two great colleagues in Tony Ward, who is the chair and professor in public health, and happy to say Dr. Damian Chase Begay, who is now research faculty here at the School of Public and Community Health Sciences as well. So our topic today is about some work that we've been doing as an academic health department. The first thing I wanted to say before I turn it over to Tony is that we really want to honor what has been done in this topic before and what's going on right now. Because a lot of times people like us, maybe in an academic health department, jump on board and it seems like we're saying, well, we're going to do this. No one's been doing anything. Nothing could be further from the truth. There's been numerous efforts that have happened here in Missoula, private agencies, the city, county, and the state. So we're looking forward to moving that forward with you. There's still much work to be done, obviously. Our aim is to be inclusive and participatory in this work. You'll hear a little bit about that later. Please use the chat liberally to kind of put down any ideas that you have. This is a wicked problem and something that needs all the ideas that we possibly can put forth in order to be effective. So at this point, I'll turn it over to Tony Ward, and then it will be Dr. Damian Chase Begay, and then we'll also have some students and others that will be presenting some about the work here. So Tony.
Hi, everybody. Thank you for joining us today. I'm going to talk a little bit about the academic health department and kind of how the academic health department got started and how we've kind of gotten to this point with addressing this issue of houselessness. Then Damian's going to talk a little bit about kind of what we are doing with this effort through the academic health department arrangement, and then we're going to highlight a couple of projects that our School of Public and Community Health Sciences and Missoula Public Health are working on collaboratively. So let me do a screen share. Hopefully this works. Okay. So our academic health department, that was an idea that came from Ellen Leahy way back in 2018, late 2018, early 2019. And she, this was pre-COVID, and we had talked about, what are some ways that we could work together and, kind of taking advantage or formalizing some existing projects that were organically happening between Missoula Public Health, at the time Missoula City County Health Department, and in our School of Public and Community Health Sciences. So we kind of framed out like what this formal arrangement could look like, and we have filled out an application with the Council on Linkages between academia and public health practice, got signatures from the Missoula City County Board of Health and our University of Montana folks, and this agreement was formalized in late March of 2019. So this academic health department, it established only the 21st state with Montana having one, and to date we are the only academic health department in the state of Montana. So as far as what went in that memorandum of understanding that we formalized, what we are going to do and working together. Basically, what it did is, like I said, formalizing some things that were already happening between our respective programs, collaborating on public health projects, including the applied practice experience, which is the kind of the capstone project for our master's students, or the health department that they agreed to contribute to serve as mentors, student advisors, guest lecturers in our classroom, and mentors for our students. We agreed to provide technical expertise and resources, come and speak at their meetings, provide some opportunities for wellness and other things. And then, so basically it was just formalizing, working together on a variety of different issues. So this is kind of a continuation of what I just said. And one thing I'll add is that we agreed to have annual symposiums where we would come together and work and kind of formally highlight the specific projects that we were working on together, and then having a constant evaluation of like what are some additional kind of looking ahead, what are some additional things that we can work on, emerging issues collaboratively. So we had our first academic health department symposium here at the University of Montana way back in September 4th, 2019. And had a lot of folks from the health department come over here to the University of Montana. And the different topics that we talked about was talking about the Invest Health neighborhood study. We talked about the community health assessment that was ongoing at the time, a discussion about wildfire smoke. What are some strategies and messaging that we tell people to stay safe during forest fire events? And then also talking a little bit about immunization services and delivery research. So then not long after that, COVID-19 hit. And, so things really kind of, we were just all holding on for dear life at the time, but, we were still kind of working together on some different things, but really the whole focus of this academic health department arrangement, it shifted, as a result of COVID. Then all of a sudden we had a lot of our epidemiologists here at the University of Montana, Ethan Walker, Aaron Simmons, Aaron Languth, Curtis Noonan, Sophia Newcomer. They were all directly working with Missoula City County Health Department in providing technical expertise, their modeling skills, their epidemiological skills, and working on a professional level, but also as concerned citizens of Missoula. So we Elle and I, we tried to hold things together, and we actually pulled off a conference during the middle of the pandemic, and it was by Zoom, of course, but we kept that momentum going. And then the next year, 2021, we kind of skipped it because everybody was kind of struggling at the time, but we picked things back up in May 2022, and we had our first in-person meeting in a long time, and folks were wearing masks. We were kind of socially distanced, but we actually met in person and had a hybrid component. And at that time, and looking back at this agenda, it was very COVID heavy. We developed, some wellness offerings to support, the COVID incident command team at Missoula Public Health. Vaccine hesitancy was a topic that we talked about. We talked about the COVID epi situation unit and also wildfire smoke. So fast forward a year, things were kind of back to normal. We were talking about normal stuff again. We talked about the evaluation of Montana's public health laws. There was a big study at Seeley Lake looking at levels of PM 2.5 throughout the communities. So we had a student here, Kristen Cram, who now works for us and working with Ben Schmidt at the Missoula City County Health Department and doing a big study. And so we talked about that study and the results of that study, and then connecting academics and practice through student engagement in the coming years. So this kind of set the stage for the future, this last bullet point, and really kind of brainstorming like what are some different topics that emerging that we could really focus on in kind of the next iteration of this. In the meantime, and I'll let Damian talk about this, that we started seeing, more of a problem with urban camping and some other issues related to houselessness here in Missoula. And, the Missoula Public Health was starting to get a lot of questions. And he came to me in the summer of 2023 and said, hey, how about we, tackle this issue as kind of the next step for this academic health department arrangement. So we kind of shifted gears. We planned with Ellen and Jim Cringy the Houselessness conference that was held at the Missoula Public Library January 10th, 2024. And the goal was to bring together and focus our efforts in assisting in the community's work addressing houselessness, using the planning meeting conference as an initial step, using it as a forum to seek ideas, expertise, and advice of community stakeholders on houselessness to guide its roles and actions. So we had that meeting, and just a really outstanding sharing of ideas, and identified 7 different topics. And Damian, I think, is going to talk about what those seven different topics are. And after that, I'm going to share some of the kind of the things that we're doing on our end, utilizing our classes here at the University of Montana and working with Missoula Public Health to address this issue. So, Damian.
Awesome. All right. So yeah, like Tony mentioned, there we go. So when I first reached out to Tony, I was the director of Missoula Public Health, and I basically at this point was looking for any and all help related to public health, local public health's role in addressing houselessness. And so, we had talked about this idea of, well, let's, have a conference or a meeting. And Dr. Cringy is actually the one, I think it was you, Jim, that had found the search conference method of doing this kind of work. And so we looked into that, and it's a great method. The only thing is we didn't feel like we had the time available to us to really walk through the process the way it's laid out in the literature. So we kind of did a modified search conference. And so you can see here on this diagram, we still followed very similarly the flowchart. We just did it in a much more expedited timeline. And so, but basically, we brought together various stakeholders. And so the folks who were there, we had faculty from public health, from social work, from sociology, from the School of Business. And I really am not intending to offend anyone if I forget any other departments that are there. Jim, Tony can pop them in the chat. But so we had faculty from several different departments. We had students from several different programs here on campus. We had representatives of both the city and county of Missoula, because we are all, struggling on what is the best way to, respond to the houselessness issue in our community. And then, of course, because, we're the research side, we also needed the practice side. And that's the whole idea behind this, was to create research practice partnerships. So we needed the practitioners in the room. And so we worked with the Missoula Houseless Leaders Roundtable and had representatives from, I think, about 8 or 9 different organizations here in Missoula that do work around houselessness, not all necessarily, but the Poverello, I think, is one that immediately pops to mind, YWCA, but also, the work that United Way is doing with TSOS, that All Nations and Partnership Health Center are doing with meeting healthcare and mental health needs for the population. So it wasn't just shelter and housing organizations. It was the nonprofit organizations that are trying to meet the needs of our unhoused neighbors. And so we brought everybody together and walked through a process. And so, oops, if my work, there we go. So we only met for one day, unlike the search conference method that's a little bit longer. And so you can see the flyer, but the main thing I pulled out is you can look at, so we were there, I think on the left it says 10 to 3, that was a misprint, it's supposed to be 10 to 2. And so, over the course of those 4 hours, what we did was we knew we were going to have faculty and folks who are very versed in research, but maybe not as versed in the houseless community, the needs, the practices, the programming that's in place. And we knew that we were going to have practitioners who might not be as familiar with research methodologies. And so we took some time to really do just some foundational basic education about, what does translational research look like, and what do those kinds of techniques, look like for this kind of topic. And then we also had a panel update us on, well, this is what the work, like Dr. Cringy said, there's a lot of work happening around houselessness. We did not invent the response to houselessness. And so we wanted to hear about all the great work that's already going, so that we could make sure that we were being complementary and adding to the equation. And so we had that in the morning. And then in the afternoon, we spent time coming up with first our large topic areas, and then within the topic areas, specific projects that we thought were good research practice project. So we were not going to go out and do something like create a whole new organization or create a whole new social service program. What we're going to do is find a way that researchers and students here on campus can inform and support the work that the practice community is doing. So I know on the left, you're not going to be able to read all those. It's really small, and that's okay. I just wanted to sort of give you an idea of the process. So we came, to the table with 8 different ideas, and then we ended up adding another 6. And so we gave the group who was there an opportunity to vote. We knew that we couldn't address 14 different topics. We knew we couldn't. So we said we want to narrow it down to we said originally 5. And so we did a voting process with the participants who were there, and they helped us pick the 5 final topics. And then even at that, 2 of the groups sort of decided that their work was closely related enough that they joined together. So what we ended up with were 4 breakouts focusing on these 4 topics, centering the voices of lived experts, legal, epi, and policy around houselessness, prevention of houselessness, and evaluation. Let's see, my Zoom's in the way now, so I have to move it. Okay, evaluation of programs and services, which originally was one area, and cost of service, a service cost analysis, which they combined together. And so those were the 4 breakout groups. And then we asked each of those groups to come up with some ideas for projects. And then we ended up with 16 project ideas that we narrowed down after the fact to 7 that we thought were the most feasible within the time, scope, and limited resources that we had. And so I'm gonna just walk through those real quick. The first is a narrative study. I'm not gonna go too much into this because we have folks here today who are gonna talk about that, but that really was focusing around, if we want to center the voices of lived experts, how do we do that? Like we as research practitioner, research faculty and practitioners, we're not necessarily gonna know what that should look like and could look like. And so the first study was really to find out what there is out there for us to incorporate into the work that we do. The second project that was identified was a social network analysis. And that was really, if you're not familiar with social network analyses, it's a pretty thorough and focused study that really just helps you understand the landscape of the services that are out there. Who is doing what, who has what amount of resources, who has how many numbers of programs and staff, and what are they working on. And so it was really clear that if we want to be contributing to this process, we need to have a really clear idea of who's actually doing the work and what work they're doing. And then the economic group also came up with the idea that we need to understand, in order to come up with realistic and propose realistic solutions, we need to have a real clear understanding of what the housing market looks like and how it's changed over the last, say 10 years. And so a housing market analysis was one of the projects that was proposed. And then the Missoula Public Health, as well as the City of Missoula, Missoula Police, City of Missoula Police, Missoula County Sheriffs, many of us have received and log complaints that have something to do with houselessness. And so we thought it would be really important for us to understand some of the issues that are occurring, to go back and look at those complaints. Because the thing is, the organizations that are taking in those complaints, Missoula Public Health, the police, the city, they're taking in the complaints, but they don't necessarily have staff in the bandwidth to go through and analyze those complaints. And sorry, my light just turned off. So I went from being highly lit to unlit. But so the idea is to go through and analyze those complaints. And then the 5th one is a comparative local government policy analysis. And really we know that we are not the only community in Montana who's dealing with houselessness. And we wanted to know, like, what are other communities doing? Do they have policies in place? And if so, what effect are those policies having both positive and negative or unintended consequences? And then number 6 was, for environmental health, we have to, as the public health, local public health agency, we have a responsibility to protect the environmental health of Missoula Valley. And so what are some best practices around urban camping and houselessness where we can do that, where we can meet our objective of protecting health, but also do it in a way that is respectful and responds to the needs of our neighbors. And then the last thing was to do, there's a system here in Missoula, it's called the Coordinated Entry System. There is, like the complaints, there is a lot of data in there around who is accessing services related to housing, either housing assistance, housing insecurity, or applying for public assistance around housing, and understanding who is doing that. What are some of the risk factors that we see that are highly correlated with housing instability and housing insecurity? And then having a better understanding of where, if we're going to do prevention, so this came from the prevention group, if we're going to do prevention work, is there a time and space, a space and time along that continuum where we really need to target, where like this is where we see if something isn't done right here, this is when we see a real movement into houselessness. And so to really focus on making sure that we keep people from ending up crossing that point in time. And so those were the 7 projects that we came up with. And the idea, before I pass it back over, is I just want to highlight that these are research practice projects. So these are things that researchers and students can do that help inform the practice that is actually happening here in Missoula. This is not programming and services. So we're not going out, like I said, and trying to, develop funding streams, for more shelters, for more staff. Those things are all needed, but we know they're needed and our providers are already working on that. This was an opportunity to say, hey, as practitioners and providers out in the community, if you had access to someone who had an expertise in research and someone who had the bandwidth and the ability to do some research, what would you want to see come out of it? And so those were the 7 topics that we came up with, and I'll pass it back to either Tony or Jim. I can't remember who's going after me.
I think it's me, Damian.
All right.
I'm gonna go back to my screen. So we have been in the process of, I guess, working with several of the instructors for this semester, looking at like what classes are you teaching? Do you want to take something like this on, incorporate some of these the things from the 7 research projects that Damian identified, and can we address that within our respective classes? So we've actually had several other classes within public health, but also some interest from the Masters of Public Administration program. Sociology is hopefully going to be involved with this next semester, as is social work. So other departments are also interested in working on this project. But I'm going to talk a little bit about just the classes that we have this semester and summer session that are working on this issue from our public health academic part. So I'm not going to talk about this first one because I think you're going to hear a little bit more from Jim and Allie and others talking about the narrative study. So this is the name that the folks that are working on it, the instructors. This is the class. This is what priority from 1 through 7 that we're going to address. And then this is the number of students that we have participating in these efforts from our end. So this summer, Dr. Anna Languth is going to be offering a class on, it's an independent study class, and also she'll be teaching a class in fall, spatial epidemiology class, and using, her expertise in GIS and in high-end modeling. She's going to be working with her class and addressing, issues from 2 through 6. And so students are signing up for that class now, and if you're looking for an elective this summer, it's going to be a really great class to take. Claire Adam is leading our fundamentals of biostatistics class this semester, so she is going to be working on bullet point number 4, and maybe that's changed a little bit after a discussion just last week. The idea is that the Missoula Public Health and others will be providing a data set to her class, and then she'll be working, addressing this issue as a class project based on the data set that she gets for her class. We have an undergraduate public health policy class that's led by Damian. That she is working remotely from the East Coast. Actually, she lives in Miami, but she's working remotely with all 14 of her students, addressing a policy, addressing houselessness through different policy analyses. So that's going to be a lot of her class project, is working on these policy analyses. And then just this past week, we had I teach at a graduate level environmental class, and Yoon-hee Cho teaches our undergraduate level class. We had Shannon Terrio and Gina Miller from Missoula Public Health, and then Lori Christensen from Gallatin County talk to our classes about what the issue is as far as urban camping and solid waste and all the issues that are rolled into that. And for my class, we're going to be involved with doing a deeper dive on trying to understand what other communities are doing to address the urban camping issues within their communities. So, and at the end of this semester, what we hope to do is present the white paper back to Missoula Public Health, to Gallatin County, and to others that are interested in addressing this issue, the urban camping issue, on summarizing like what are best practices, what are other communities doing that's showing success in addressing these issues within their counties or their communities. And then Yoon's got several students that are working on different projects and doing reports within the context of urban camping. So that is kind of a summary of the projects that we are working on within our respective classes here at the University of Montana. And I am going to turn it back to Jim, who's going to talk, kind of set the stage for this narrative study that other folks are working on.
Thank you, Tony. Even though I've been involved in this since the beginning, it's really something to hear, how it's grown and how many students are involved in it. So that's super cool. So I'm just going to talk briefly, then I'm going to hand this over to our Master of Public Health student, Ali Manuel, and then also Tony and Damian. I believe we were going to get a brief update from Claire Bopp from the Pavarello Center. So we have that to do. And reminder, please put whatever comments or thoughts you have in the chat. So one of our first ideas was based upon the search conference, was that we were going to move forward and quickly try to get some kind of a narrative going in terms of houselessness in our community of Missoula, and what would that look like. So a group of us got together at the library that has grown, that's inclusive of people from the county, the city, and other agencies, the university. And what I'll say is that it is not going fast. I think Ali will agree with me. And that is for good reason, because we wanted to really live participatory and translational research, meaning that we can't move forward. We're not researching on people, we're researching with people to try to figure out what's going on and figure out what I would say the theory of the problem is before we try to address it, to make sure that we're strategizing in ways that are going to be the most effective. So Ali was a very brave student, and that she agreed to be our first facilitator for the first couple of meetings. And when you have so many passionate people together on a Zoom, that's a difficult thing to do, and she did great. So Ali, I'm going to hand this over to you to give some details on our project.
Sure, thanks, Jim. As Jim said, my name's Ali Manuel. I'm a current grad student in the CHIPS program, and I'm actually graduating this semester. I'm a member of the narrative study group, or I feel like we kind of centering the voices of those with lived experience is kind of how we've been describing it. So far, we've met 3 times with reoccurring meetings every other Wednesday at 3 p.m. And as kind of Jim spoke, so far we've been really just more focusing on identifying our values as a group, which I think are going to be really closely rooted to the community participatory based research types of principles. And we're also trying to ensure that all the planning is inclusive and that the research will be done ethically. Our next meeting will be April 3rd, and hopefully we'll take person at Partnership Health. And we hope to have a few people with either current or lived experience with houselessness at that meeting. Because as a group, we've decided that this perspective is needed early in the stage to kind of identify our aims and objective. And yes, that may make it take a little bit longer, but we feel like we're going to get, more of a rich like experience and context about what is happening. Sorry, understand the context surrounding how Missoulians are experiencing houselessness. And then beyond that, we're still at the very early stages. We're still figuring out our research questions and the type of methods that we'll be using. But I feel like we have pretty good momentum. And anyone who's interested in joining the work, please feel free to reach out to me. I can put my email in the chat, and I can happy to share you guys the invites and all the previous notes. Do you have anything else you want to add, Jim?
I think that's great, Allie. Thank you. Appreciate it. We're kind of living the participatory thing. We're switching out who will facilitate, who will take notes, and it's been a really cool kind of flat leadership process to tackling what is a really difficult issue. Highlighting the fact that our next meeting in a couple weeks will hopefully, with the leadership of David Quattracci, bringing the unhoused people that he's working with into our meetings such that we have, that voice, and they will be compensated. And we're going to try to live that process there too. So I want to thank David for ensuring that we were doing this the right way from the beginning. So, Claire, are you able to give us a bit of an update from your perspective? We feel really fortunate to have you here today.
Yeah, can you hear me okay?
Yeah.
Sweet. Yeah, my name is Claire Bopp, and I'm the Director of Shelter Services at the Poverello Center. So I was going to talk a little bit about what the POV does, but I might skip that and talk more about coordinated entry, our community partners, and some things going on in Missoula that dovetail nicely with this work that the Academic Health Department is doing. So yeah, I work at the POV. I started out there as a practicum student in 2016 and have stayed with the POV since then in a couple different capacities. And the POV is a homeless shelter and a soup kitchen for people who are homeless or at risk of becoming homeless. And I should clarify, we serve only adults. But the important thing, and I guess the thing I wanted to talk about most today, is that we work collaboratively with a consortium of other agencies in this town that have similar goals, which is either to provide shelter services to people who are experiencing homelessness, or making that experience of homelessness as brief and non-recurring, as possible. So some of our community partners include the temporary, or now it's called transitional safe outdoor space, TSOS, which is a partnership between Hope Rescue Mission, the county, the United Way. We work closely with the city of Missoula, the YWCA, which serves women, families, and children experiencing homelessness or domestic violence, Mountain Home Montana, the Missoula Interfaith Collaborative, and we also work pretty closely with outreach teams at both Partnership Healthcare Center, the sort of mental health agencies in Missoula, like Western Montana Mental Health, Winds of Change, Three Rivers Mental Health, and so on. The thing one thing that is kind of interesting and not unique necessarily, but is newer to us in Missoula, is that we all share a database. The Poverello Center, in collaboration with all those agencies, share a database to track people experiencing homelessness. And part of that is sort of tracking what services have been provided, what services make sense to be provided next, and also coordinating those services amongst agencies. And the point is to sort of like lessen the burden as much as possible on the person in homelessness and reallocate some of that work and energy to the system. So as a service provider, I might have a list of people identified by the system that could be a good fit for the services I'm able to provide, which we're getting used to as a system. The old way would be you would be provided a resource list, and the person experiencing homelessness starts knocking on these different agencies' doors, and we're trying to share some of that work in a more equitable way, I guess. But yeah, we share a database, which is our best way of tracking the number of people experiencing homelessness in our community, which the data I have from the city shows that there are about 700 unique individuals experiencing homelessness in Missoula as of this fall. Unfortunately, I don't have anything more recent, which is a lot of people. Part of our work with the homeless information management system is to assess all of those individuals for risk factors associated with homelessness. But we definitely, it's a challenging assessment to administer, and 700 is a lot of people. So I don't know how many of those individuals actually have been assessed, but we're trying to do a better job of tracking that data. 700 people is a lot of people, but it's not necessarily a super surprising number. For me, I think since the pandemic, our community has seen between 650 and 850 individuals experiencing homelessness. But what is new is like maybe the amount of attention homelessness is receiving from the community, but also, from Missoulians, from Montanans, and then also we've been getting, attention from like the Washington Post, the New York Times, in places like that, some big media outlets. And so this is a topic that people are talking about and very interested in, which from where I sit is a good thing. Like, I appreciate the attention and the desire to collaborate and solve problems. So that's one of the reasons why I think this partnership with the academic health department is so exciting. But one of the reasons I kind of think homelessness might be getting a lot of attention is, I think, because urban camping is more visible than it has ever been, or maybe than it has ever been. And I think that's probably related to the Reserve Street encampments and closing, to some Ninth Circuit court decisions like Martin versus Boise and then Grants Pass. And then also the affordable sort of housing crisis. But yeah, with that visibility, we're also getting a lot of interest. And so some of the things our community is working on would be the Missoula Economic Partnership has hired an economist to undertake a study that shares and illuminates some of the economic costs and impacts of homelessness. And that report, I think, is in its finalization stages and will be out and available to the public soon. Missoula is also participating in what is called Built for Zero, which is a nationwide program that uses sort of like data benchmarks with our homelessness management information systems database. So using these benchmarks to help communities like ours reach functional zero, which is that the number of people entering homelessness is the same as the number of people exiting. So not to make it so that there are no homeless people ever, but that people enter and exit quickly. The city is working on a few things. They're going to be coming up with a new strategic plan for addressing homelessness in Missoula. It's like the next 10-year plan, but I don't think we're calling it the 10-year plan. I think it will have a new and exciting name. And then, yeah, the mayor is facilitating currently a working group that is talking about urban camping. So that is a group of 25 or 26 stakeholders coming together to name problems and then come up with solutions to those problems. And then, yeah, this Missoula Academic Health Department focus on houselessness is another definitely exciting thing for our community, relating to the whole topic of homelessness. So I think that's everything I'm going to talk about today.
Thank you, Claire. It's really great to hear everything that's going on, and I'm struck as someone who helps organize these seminars that this is one of the most well-attended ones we've had of the semester. So it just goes to show how much people care, and what this community has the potential to do in Missoula, and in our state. So Tony, I'm hand it back over to you, I think, and we'll try to solicit some comments or questions anytime we have left. Damian, please feel free.
Thank you, Jim. Thank you, Claire and Allie. So at this point, we don't have much more to talk about from our end, but we would love to get some questions from the audience. We have several experts related to this field on the Zoom. And, for me personally, it's been a learning experience. And I think I made this comment earlier. It's not just working on a research project, but being a resident of Missoula and being a community member and gaining just an appreciation for not only what we can do, but like, why is this happening to begin with? And the more we can address those upstream issues and all work collaboratively and strategically and responsibly in trying to address this issue. It's been a learning journey for myself, and I've just gained a greater appreciation for for the problem, and a greater appreciation for the folks that are helping to solve this problem. So with that said, I would be really interested in hearing other comments, other questions from this audience. Are there other things that you would like to see us working on related to this issue within the academic health department arrangement? And then also other projects that you would like to see our students working on. And the more that we can identify, like, here's some things that from the health department and from the POV, like, we want you guys to work on this. That helps us from our end, kind of advertise that, recruit folks to work on it, and have a captive audience working collaboratively from our end with deadlines to make progress on these issues. So we do have a comment from Annie B. Annie, do you want to just jump in and talk and or I could read your chat?
Sorry,
There
it's
she is.
dark here. So part of the question is just sort of gentrification and how that pertains to, many of our urban areas in Montana, Missoula County included, and elsewhere, and how that impacts people of color and equity, and how we can sort of work to begin to mitigate some of that. Because there's a lot of folks who, I know a lot of people who are impacted by this issue, and it's there's a lot of predatory practices that are occurring right now in housing, and even things like people who are living in campers and who have lot rent that's like $900 just to put a camper there. So there's a lot of predatory practices, and I wonder how we can think about, as a community, decreasing some of that inequality and looking at, maybe if it's exposing some of these practices, these sorts of things, but it's really creating a less diverse community for people here in Missoula. So just wondering if there's any thoughts about that, or.
I don't necessarily have any thoughts, but I would add that with the data we collect on people experiencing homelessness, our community collaborated with some HUD technical assistant people to undertake sort of like a racial equity kind of assessment of Missoula, and through that we have learned that people in our community, people of color experiencing homelessness at rates that are disproportionate to the general population. So we know people of color are experiencing homelessness more for longer and are more likely to be unsheltered, so camping and things of that nature. Also through that process, we were able to undertake some like a light focus group type activities, and we learned that people of color would like to live next to other people of color. And so there's some interesting projects like out of Portland, where a housing facility will be, prioritize Indigenous people, or I don't know, sort of cater services to people based on their like ethnic or racial identity. And that's not something Missoula has, but I think is something our community could work towards, and I think would be successful here. But that
Well, and
was
then one
about racial
thing-
equity, sorry. Or I mean, gentrification.
One thing I was going to mention was that the housing market analysis project that was proposed, one of the things that they did actually want to include in that, and I think the idea is we're hopefully going to be working with some faculty from the School of Business to do that, because it is an important public health topic, but public health faculty and students don't necessarily have expertise in housing market analysis, but the School of Business does. And so one of the things that they wanted to look at was if we could quantify the number of housing units here in Missoula that over, whatever the last 5 years, last 10 years, have converted from affordable family housing to either market rate or luxury, to point out just that it's not just that new developments are not targeting affordable family, it's that the developments that were there that had affordable family housing are also being converted out of price range of affordable family and low-income housing. And so that is intended to be part of that housing market analysis. And the idea is that in order to inform policy and practice, it's great. I think I've found in my experience, there's two things you need. You need really good data and you need really good stories. And so the housing market analysis and some of the other projects can really focus on that data. And then the narrative project can really focus on those stories. I think is something that I might offer.
I have a question for the experts, Claire and others. So what, how have things changed since COVID-19? Like is it, is what we're seeing now, is it just everything more expensive? Like what role does COVID-19 have in that, in what we're seeing now?
This might not be, I guess, what you are intending, but I think the COVID-19 and sort of the money and funding that came down from the federal government to support communities as we were navigating the pandemic has allowed Missoula to sort of experiment with programs that we otherwise wouldn't have been able to. I know TSOS has been facilitated largely in part due to money that came to us from pandemic related funding, ARPA, I'm not 100% sure. The Johnson Street Warming Shelter, which is our community's first like low barrier drop-in type shelter for adults, was funded in part through pandemic money. I know the HOT team and other sort of outreach programs were their programs were bolstered by pandemic funding. And so I think one thing that came out of the pandemic was that we were able to experiment with different programs and models, and have found that some of them work well in our community. And then that funding is going away soon, I think. So we're at this crossroads trying to navigate like what do we want to continue with moving forward, and what was just sort of a pandemic program. But I don't know about other trends necessarily. Maybe David has some ideas.
Me?
Yeah.
Sorry, on what specifically, Claire?
The
On
question, oh, sorry, go ahead, Claire. No, I was just gonna say, the question was, uh, what do we think the impact of COVID-19 has been on houselessness, on our ability to meet the needs of unhoused neighbors, have their needs changed since COVID? Have the providers had different challenges meeting those needs since COVID, broadly?
Oh yeah, well, yeah, thanks for queuing me up then, Claire. Other than what Claire said there, I've noticed just a dip in trust. I think we have this kind of narrative swirling of people being service resistant, who live outside or in shelters, or even though the shelter is a service itself, that proves non-resistance, but that people took part in programs over while COVID was going on, and there was usually, and this don't want to speak for every town, some kind of nebulous offer of housing or some kind of reward for participation. I've just noticed a dip in trust from a service provider point of view, where people did participate or partake in services during that time. So having a lot of that money pulled out or not re-upped, I think has dented trust for a lot of people outside too.
I think when it comes to thinking about the impact of COVID on rates of homelessness, we actually need to pause and go back farther, because during the recession, starting in 2008, there were some very profound changes to public policy as they relate to public assistance. And really a lot of stripping out of benefits. And so I think that COVID-19, with job loss, benefit cliffs, increases in housing costs, are for people who are vulnerable and just hanging on, that layers over earlier policy changes that left people and families without enough of a safety net. So it might be necessary to back up a little bit more and take a longer view on the public policy side.
Thank you, Dr. Goldstein Cole. Any other comments or questions?
If it's all right, this is B-Rad. I'll just chime in really quickly. I've got my position. I work at the health department, Missoula Public Health, and I'm an RN. My focus is infectious disease and preventing the spread of infectious diseases. So a lot of this talk around COVID, is tied into that. More specifically, this morning I was talking to Team Awesome. That's what we call ourselves, the team of infectious disease nurses here in Missoula. And we looked over our line list of case reports that we get in, and we noticed that the majority of reports that don't have an address attached to them come with hepatitis C. There's a lot of good outreach. Open Aid is doing great testing and connecting with the community. But yeah, we certainly have a lot of concerns about what infectious disease could look like in the unhoused community. Access to care, something like a small superficial wound, when someone doesn't have access to hygiene and healthcare and antibiotics, can get a lot worse than it needs to get. And just like to have maybe an opportunity to explore this and gather more data. One of the problems I've noticed is people might have an address on paper, but it's hard to determine if that person actually lives there or is staying on a couch there or gets their mail sent to their, someone's house that they know and trust. So one of the struggles we're going to have to figure out is a good way to get reliable data on whether people are living at their addresses that we get in case reports, or whether, they might be part of this community. So I guess that also ties into maybe a further conversation on really defining the inclusion and exclusion criteria for the population. Thanks for the opportunity.
Thank you, B-Rad. Yeah, excellent thoughts on another area that we need to be considering. So we are nearly out of time. I want to respect everyone's time for coming today. Really appreciate it and thank you. Also say that, you know, Allie put her email up there. Those of us at the university are pretty easy to find. I think we can find Claire and others as well, the Pavarello website. So yeah, we're really hoping that we can just keep doing this together. Again, I just really want to say how heartening it is to see so many people show up today so we can talk about this and not just talk about it, but translate talk into action to impact our community's lives, people that live here. So thank you very much for attending today. Appreciate it. No, next week, we will not have a seminar. We will resume in 2 weeks. Have a good couple of weeks, everybody.